sweaty, diaphoretic. Their heart is racing. Many times they're shaking. They can have gastrointestinal upset. They can have diarrhea. They can feel like they have like their head is just kind of spacey. That's one of the common symptoms. And sometimes if they have a pre-existing cardiac problem, and a lot of times people don't realize it, and they take a lot of caffeine, it can cause their heart to go into palpitations. So they feel like their heart is beating out of their chest. We've actually had students come in here with their heart into an arrhythmia, where they had so much caffeine that their heart actually went into a different type of rhythm that caused it to beat twice as fast as it should be beating.
Obviously, like, it has a lot of bad chemicals, know that, but I don't know what they are directly and what they do to you. But I kind of don't care either way. Like, I feel like even if I researched it and found out exactly like what they do and all the negative side effects, I don't think it would make me stop drinking it.
Caffeine intoxication, according to the American Psychiatric Association, can be defined as the overstimulation of the central nervous system due to the presence of large amounts of caffeine within the body. While caffeine in small amounts is widely known to increase alertness and deter lethargy, caffeine intoxication is a big problem among college students. The LPC campus is just as plagued by it as many of the college campuses in bigger, more bustling cities. But why do these people continue to consume such large amounts of caffeine despite the warnings?
Because they're multitasking. They're young adults, they're multitasking. Many of them are working, going to school. They're trying to do a lot in a 24-hour period of time with as minimal sleep as possible and keep their social life. So we see a lot of that, especially during final exam times.
So it helps me wake up in the morning. Well, my morning, because I work graveyard. But it doesn't really keep me that much more awake throughout the day like it would like a normal person, just because I drink it so often. But like if I don't drink it, then I get like headaches and I get really shaky. Like if I don't drink it, or sometimes if I drink too much, I still will get shaky. So I kind of shaky all the time. But I like crave them if I like see one and I haven't had one in a while. I'll like want to drink more, and then I'll go buy one. And then like when like I first drink my Red Bull, like I get so much happier.
That
like,
I'm surprised people can make it throughout the day without having drink coffee or get caffeine or Red Bulls or Adderalls or anything like that. Just some type of boost, because you're just required to do so much. Like I wake up at 4 a.m., I commute to school, I go to class, I go to work, I work out, I babysit. Like I do so much that I need that extra push. I need that little bit of help. And with modern day Starbucks on every corner, it's right at your fingertips. It makes it really easy to get.
While one of the smaller 80 milligram cans of these carbonated energy beverages may be safe to consume, Barbero says the problem lies in the fact that most people consume more than one serving, and most cans, the larger ones, contain more than one serving, which people consume in one sitting.
I consider caffeine more of a necessity than a luxury item. I allow a certain amount of money to go towards it out of my paycheck, probably $10 a day, $10 or $15 a day. I go at least 2 or 3 times a day.
I think at this point it's just because I'm like addicted that I can't stop drinking it. Like it's like I formed a habit like every day.
Let's say that she also has diarrhea, which is very common if you're drinking if you're drinking a lot of caffeine over the day. Then she's going to have inflammation of her bowels, which could increase her chances of getting cancer. The other thing is that if she's having a ton of caffeine and very acidic stuff, she can get gastroesophageal reflux disease, which again can increase her risk of chances of cancer, and also increase the risk of erosion of her esophagus. If she has any pre-existing heart conditions where she's having caffeine and putting extra pressure on her heart, what that can do is increase her risk for hypertension if her heart is having to work harder than it should for a longer period of time.